I want to ask you, Stu, because you watch the stats, and I am really confused because I see stats and I think this is good. Things are getting better. And then, and I don't trust anybody because I watch the news and it's almost like they're cheering for more people to die and us to stay in our houses forever. I just don't know who to trust. And these stats are so all over the board. Can you tell me what's really going on in, let's say, New York? The numbers are coming down, but now they're saying that we're not counting everybody, and yet we are counting everybody in some way or another. If you die of a heart attack,
right,
and you had coronavirus, then you're counted as coronavirus. So we're counting you that way, but we're not counting the people who die at home. So what the hell what's happening?
Yeah, it's really confusing, I think, to people because they're trying to understand this, massive thing going on, and it's difficult to kind of understand. However, I think everyone does know this, right? From the beginning of the entire coronavirus situation, we've been told one thing very clearly that hasn't really changed, which is this affects mostly, when it comes to death, mostly people who are older and have pre-existing conditions, right? So that is very, very well known, and I think, in fact, was used as a justification as to why we maybe shouldn't, why Trump was wrong in shutting down the country. A lot of people were saying, well, they shouldn't do that. It's only people who are old and have pre-existing conditions. Well, now this has become a question where some people, who have looking at these stats maybe for the first time, don't understand how cause of death is recorded. So what they're saying is, if someone goes in and has diabetes and high blood pressure and then gets coronavirus and dies, does that count as a coronavirus death? Well, Dr. Birx was asked this yesterday, and she said, well, yeah, that would count. And so a lot of people are like, I can't believe it. This entire time, they have all these other ailments. Of course that doesn't count. That's not a coronavirus death. Well,
we count those as flu deaths.
Exactly. The 50,000 number we say all the time for flu, it's not that 50,000 perfectly healthy people get the flu and die. That's not how that works at all. They all have, almost all of them have pre-existing conditions. If you think about it as like a pre-existing condition is someone wheeling a wheelchair up to the end of a cliff, and then the coronavirus pushes them off. Well, what's the cause of death there, right?
Falling off the cliff.
Well, yeah, but it's both, right? Yeah, it's
right.
both.
Yeah.
Right? It's both pushing them to the edge. If someone didn't push them to the edge of the cliff, the little shove at the end wouldn't do anything. And if you push someone to the very edge of the cliff and don't do anything, they live. So if you have diabetes and high blood pressure, you're living with those and you're alive. When coronavirus comes in, you die. Now, if you didn't have diabetes and high blood pressure, you might survive coronavirus. Most people do when they don't have pre-existing conditions. But the important thing to understand here is that this is how they calculate this stat all the time. Well over 70% of all deaths in the United States have multiple causes. So this is not something it's not some sham thing that the Trump administration is cooking up to make it look like there's more deaths, which is seemingly what they're being accused of.
Which is weird.
It's very weird.
I don't know I can't keep track of whose side is on who. I mean, I can't keep track of the arguments because they're all over the place. People who are big fans of Donald Trump are saying, this is ridiculous. We shouldn't be doing this. I guess he's been duped. Right. How is Donald Trump being duped on this?
He's a lot smarter than that, right? And as you pointed out yesterday, if he thought Dr. Fauci was a quack, he'd be the first person up there calling him, as you said, Fathead Fauci.
Fathead Fauci. He would be. Fathead Fauci.
He'd be the first person out there. So, fundamentally, when this is something that occurs all the time. So when you look at those models and they say 100,000 people dead, they're talking about that statistic recorded that way. If you have an elderly relative who has hypertension and dies because it was living and you were talking to them every day and going to see them, and then they get COVID-19 and die, that's still a COVID-19 death. It's also going to be recorded as having to do with hypertension, and there will be multiple causes of death. That is absolutely how they calculate this statistic all the time. What Dr. Birx was saying was that other countries right now are not doing that as often and are likely undercounting the amount of dead they have there. And which really is frustrating here when you listen to the media handle this is they almost seem like they're cheering on the fact. And I know, I'm sure if you asked them, they wouldn't say that. But like,
no, I think they are.
It's
I'm not sure. I think they are.
Yeah.
It's. I've never seen anything like it. You know, in the Second World War, FDR did fireside chats. What were his fireside chats? To be a cheerleader.
Yeah.
To be able to tell everybody it's going to be okay. They covered those things. They broadcast those things. They heralded him. They didn't even tell people that the man couldn't walk. Most people had no idea the president of the United States was bound to a wheelchair. This time, oh my gosh, we're going to be talking about in a little while what they have said about Donald Trump and how they have literally edited and twisted his words when he said, I'm a cheerleader of the United States. I'm not going to freak everybody out. Then they edited all of the words out. Unless you watched it live, you have no idea what he actually said. I think these people are absolutely on the wrong side.
Well, maybe the clearest vision of that, I think, is how they're treating hydroxychloroquine, where the president is clearly coming out and saying, look, I have high hopes for this. There's been some anecdotal success. We've seen some early success in some small studies. We really hope this happens because if we can get a treatment for this, this is going to change. It's a game changer. And they say, like, he's giving away unproven medical advice. He wants people to just take this. You know, look, he's not saying that. You all know he's not saying that. And it seems as if, just by the tone of much of the reporting, not all of it, but much of it, that they would rather have Trump be wrong than have this medication work, which is like insanity, right? Like, we all understand that it's not necessarily the magic pill, but we would love for this to actually work, and maybe it will. Maybe it will work for a subset of the population. Maybe it'll work for 10% of the population. Maybe it will work for nobody, but, you know, there is reason for hope there. And there are a lot of doctors who believe and have used this with success. The fact that the coverage is all constantly critical of Donald Trump for even bringing it up. They even tried to go down this road of saying, you know, Donald Trump owns part of this company, and he is. I
don't want to hear it.
He is making money off of this. First of all, he's also closed the economy, which has had that stock go down in the tank. So he's made no money off of it anyway, even after talking about hydroxychloroquine. And secondly,
could we
no money.
Yeah, could we please lead with he may have $100 as much as $1,400 in that particular company?
Yeah.
And by the way, this is an old drug. There's not a patent on this drug anymore. So you could make it. You're not going to be making money. And if he's got $1,400 in it, oh man, he could be making $8,000. I mean, in the next 2 months, he could be pulling down $8,000.
Oh, and that would be huge.
What are you?
Huge for Donald Trump's bottom line, I'm sure. Yeah, it really is. It's
and
pathetic.
the fact that the media spent time poring over all of his records to try to catch him, as instead of just saying the guy believes in this, he wants to give everybody the benefit of the doubt, give it a shot. Yeah. Instead of that, he must have some evil intent. He must be making money on this. Their attitude towards the president is despicable, and despicable because of their attitude towards the last president. When the last president wanted socialized medicine, they literally allowed him to go on in public speeches and say that doctors were cutting feet off of patients so they could make more money on diabetes. Yes. And they never said a word about it, not a word about it. Most people don't even know that President Obama said that over and over again because the media never held his feet to the fire. And then to do this with Donald Trump is despicable. And you can see it is un-American. It really, truly is un-American. I get the feeling that they want America to literally die as opposed to Donald Trump be right on anything.
It's the tone
You're
of
not
the
gonna-
like. Obviously, you'd ask any individual media member, and they would not say that that was their goal. But still, in the others, the tone of the coverage, it seems to cheer it on. Like, we really hope we caught him in one here because this is unproven medicine. And it's like, well, are you rooting for it to work? Like, I'm rooting for it to work. That's what I want to happen.
Let me ask you this. There was a story about Boris Johnson yesterday that came out, and it was all about Boris Johnson, okay? In the hospital. Boris Johnson, he's in the hospital. He's the prime minister. There's a lot of ways we could go with that story. What does that mean for England? They don't have a line of succession there. Who's actually the prime minister? If he dies, what does that mean? All of these things, let alone just, is he on a ventilator? Is he not on a ventilator? Instead, what they took is he's not, doctors there are not giving him any hydroxychloroquine.
Oh.
They're not giving him any of that. Even though Donald Trump strangely keeps pushing this drug. That was a full paragraph, like 4 paragraphs into the story about Boris Johnson.
Yeah.
Well, what the hell does that have anything to do with anything?
Yeah, it really is frustrating. And they keep going to this thing of like, well, look, there's been some, studies have shown some progress. But like this, it's not proven technology. It's very, irresponsible to recommend it and talk about all this hope. It's like, so I listened to a doctor talk about a trial they're doing on hydroxychloroquine right now. They're doing tons of trials on tons of medications. It's not just this one, but they keep focusing on this one because Trump brings it up. Well, they're in the middle of doing a clinical trial on that right now. They are moving at a rocket pace here. They've signed up hundreds of people to try it. It is moving much faster than any other normal clinical study. You know when they think they might have the first indication of whether it's successful or not? 4 to 6 weeks. Well, the peak
Why don't we just wait?
Of New York, right, is happening this week. Right? The peak of Detroit is probably this week or next week. The peak of total deaths is projected to be this week or next week. So if we wait for 6 weeks to get results from a study to see if it actually works, all of these people are going to die for no reason.
Yeah, but why doesn't the press just say this?
Yeah.
Why didn't the press just say this? Doctors are free to use it if they feel it's right. A test which will show the actual results will come out in 4 to 6 weeks, and then leave it alone.
And that's
it's up to doctors to prescribe it or not. And quite honestly, I don't understand this socialist, this absolute out of control desire for the press to control what my doctor wants to do with my body. If I am in the hospital and I am sick and he says, look, I got some witch hazel here, it might work. Load me up, doc. I tell you what, vitamin C might be good. Plant a tree in my arm. Give it a shot. I'm gonna die.
Right, and you expect this from the left, who is so concerned about the relationship between a woman and her doctor. Like, don't let the government get in between that relationship when we're talking about abortion. God forbid. But when it comes to saving your life with potentially hydroxychloroquine, that is apparently way out of line.